There are many people in this country that don't even realize how deep the dependency of the US have on China. There is no denying it. They are the biggest suppliers of so many products and medicines and materials. You can't even deny this. America can't do anything literally without China at this point because you have given so much of your jobs and everything that's really seriously important to this country as far as your resources over to China, another land. And you're going to feel the pain from this decision that was made decades ago when people in the US were put out of work and in some cases forced to replace their Chinese, a Chinese person that was taking over their job, foreigners that were taking over their jobs. See, people that got rich off of this, they did it at the expense of cheap labor. China went from really a third world country. And because of all the manufacturing companies that moved there, you made them damn near a superpower on earth. Economically, they were able to explode their economy over there. So now that there are so many things at risk, and we already seen the empty shelves over in Italy, and I'm sure it's more places, y'all. They're just not going to show it. See, whenever things are going wrong, they're going to always try to either avoid the subject or lowball any numbers that they tell you. They do it all the time. They have always done that in this country. They do it in China too. You know, they're trying to keep up this fake reputation that they are so powerful and smart and brilliant. And we all know none of those things are you. Okay, we already know this. There's no point in faking the funk any longer. So, ladies and gentlemen, there's a video here on CBS that I'm going to show you. All right, ladies and gentlemen, just from you see just from that video how much America depends on China for many things. So I'm just going to go down a little bit because the first part of the article is really much of what you saw in the video. So, ladies and gentlemen, FDA expects supply chain disruption. The FDA said last week it already expects the deadly disease, officially called COVID-19, to cause potential disruption to supply and shortage of critical medical products in the US. And ladies and gentlemen, many of us know friends, family, even children in your family that need certain medications to even function on a regular basis. Now, I want you to think about the potential of them not having that medication, or if you're in chronic pain, or you are trying to fight some type of bacterial disease and you need antibiotics and you can't have access to that, and you go to your local pharmacy and they tell you they can't fill your script because they just simply don't have the meds. What are you going to do? People are going to go into a panic over this. And this can be deadly to people, especially the ones that depend on heart medication to even survive. A lot of elderly people in America are taking a variety of different meds every day. Just imagine if you can't get those meds because of the coronavirus going on heavily in China. And I'm hearing that the situation in Wuhan is far worse than what they are telling the press. It is very bad over there, but they're not going to come out and tell you that. We are keenly aware that the outbreak will likely impact the medical product supply chain, the FDA said in a press release. I think they need to do better than that. If people may potentially be without their meds, you need to really get this out all over mainstream news, and every single website where the news is given should be putting this out. The FDA has a list of 150 prescription drugs facing shortage risk, ASIO reported over the weekend, citing sources familiar with such a list. So the agency did not outline which drugs or medical products could be hit. Well, they should tell people. All of this keeping people in the dark, I'm not down for that. They need to be upfront and tell people so they know exactly what to expect, y'all. The disease has infected more than 75,000 people and killed more than, well, I saw over 2,500. Now, this says 2,200, but you know what, y'all? That's mainstream news for you with all of their inconsistencies. What can you, you should not expect anything but that. Meanwhile, many U.S. companies with factories in China are struggling to find enough workers to staff production lines, according to the American Chamber of Commerce in Shanghai. So they're talking about workers over in China, not here in the U.S. Notably, Apple, which reported last week it could miss its revenue target for the current quarter, owing to the coronavirus related store closures and reduced manufacturing capacity in China. And see, here's the problem. You may be looking for people to staff your production lines, but at what risk? These people, if they keep going out in public and having a lot of contact with each other, they are sure to get the coronavirus at this point. Drug companies have not yet reported coronavirus-related supply deficiencies, but experts say they are on the horizon. It's definitely not a time for fear-mongering, but We could start to see shortages, Lynn says. Well, that's not fear mongering, okay, for one, especially if people are going to be out of medication. That's not fear mongering. I don't like the way some of these people come out. They really need to go somewhere and be quiet. Either tell the people the truth about what is coming and things they're going to have to face, or go somewhere and sit down. At this point, when people are short of medication, you can't tell them about some fear mongering. Please. That's ridiculous. All right. So, as you saw in the video, there are 370 raw ingredients that goes into drugs sold in the US that they have to get from China in order to make those drugs. Only 21% of the manufacturing plants that make the ingredients for those drugs are located in the US. That is not so. You got nearly 80% of your companies over in China and 21% over here in the US that can make drug ingredients. Woo, that's terrible. 15% are located in China and 64 are in other countries. 3 of those 370 drugs rely on active pharmaceutical ingredients. And those are what I was telling you yesterday in the live stream. If you haven't seen that, go back and listen to my live stream. And, it was saying that the active ingredients that are in drugs, most of the drugs in America come out of China. So, ladies and gentlemen, all I can tell you is try to do the best that you can. If you can get these drugs and have a supply of them, that's great. But if you can't, you're going to have to look for alternatives for real. They're telling you what's coming, they are showing you. Pay attention. Don't ignore this stuff. This is serious, especially if you are on medications, which means many of you folks that have flu and allergies, you need to find some type of alternative. You may not have access to those drugs. When spring come and then, the pollen is out there, that's when many people suffer from seasonal allergies. And in some cases, you need antibiotics along with a decongestant that you may not have access to at all. And those of you that suffer from chronic pain, you may not have access to your drugs at all. This stuff gets serious. Diabetes, heart medication, cancer medicines, everything's going to be impacted, y'all. Everything. So when you say don't fear monger, what are you saying to people that have to take these meds on a daily basis? What are they supposed to do? Yes, they're going to panic. Get ready for it. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.